We face incredible opportunities and challenges in translating our research for audiences outside of universities. Despite those challenges, doing translational work is vital. It's important. And so we need to ask questions about how to do that work well. An important question for us to ask involves how best we might actually approach audiences. We can start to answer that question by asking about the images and ideas that people already hold in their head before they ever encounter our work. One way to think about this is to ask a question about a seemingly simple object, an everyday occurrence, a house. What is a house? What comes to mind when I say that? Well, for some of you, it might be a simple picture. Others, though, might be thinking in terms of all kinds of levels and dimensions. And so there's variability. There's variability in how people even conceive of something as basic as a house. We can ask similar questions in terms of what's in people's heads about research. How is it that people conceptualize research? What comes to mind when you actually use that word? I think that's a good starting place for any consideration of translation of research. What is it that people are thinking about you, about your field, about your university, about the work that you do? So we can expect a very similar situation whenever we are engaged in translational effort. We've got a situation where there's a lot that's in people's heads, and we maybe necessarily haven't spent very much time thinking about addressing all of that. So a really important consideration is to ask questions about where people have been. Audiences aren't blank slates. They carry with them this notion of a mental model. They carry with them conceptualization of ideas. They also have encountered all kinds of information just prior to talking with you or hearing from you. And so the existing information environment matters as well in really important ways. So a couple of vivid examples in that regard happened in recent years when we were doing work with regards to emerging infectious diseases and public understanding of those. So the world has been beset by all kinds of challenges from infectious disease, not only with regards to our current COVID-19 pandemic, but also we've had global encounters with Ebola virus and Zika virus and other emerging threats. And in each of those cases, it's been really important as we've tried to understand public conceptualization, to understand what people think about and had thought about infectious disease prior to the new situations occurring. So we found this to be the case, for example, with regards to Zika virus. My colleagues at RTI International and I did some work in Guatemala as one example. And in Guatemala, there was quite a bit of consideration of Zika virus as a mosquito-borne disease. In fact, as yet another mosquito-borne disease. This is a population that has in recent years been dealing with chikungunya and dengue, and they had quite a vivid sense of mosquitoes as a vector for disease. And so actually, Zika sort of fit right into that conceptualization. There's a problem though, and that is that Zika virus also can be sexually transmitted between people. And this offered a twist. This was a different situation. And this was something that was outside of the existing mental model that people had with regards to Zika virus. And so it was an opportunity for a public campaign, but it also was a challenge that we needed to keep in mind. We also have seen different ways in which the information environment matters when it comes to engagement around different topics. We saw this also, again, in the example of Zika virus. Is quite evident when you look at patterns of people searching for information, patterns of social media. And what we saw was that actually people's engagement on social media, people's engagement with Google was very much a function, almost a lockstep function of what was in the wider news environment. So as news coverage rose and fell, we also saw similar rises and falls with regards to searching and social media activity. So it matters then what's in the wider environment. So let's turn our attention just for a second to our current moment as we think about COVID-19. How is it that understanding audience conceptualization might actually matter as we think about public engagement around COVID-19 research? Well, there are a number of ways that we might think about this. One is with the prospect of vaccination. So as we think about, hypothetically, possibilities for future vaccination, an important question is what seems to be shaping people's current sense of vaccination possibilities with regards to COVID-19. Again, remember, COVID-19 is a new phenomenon. How is it that people are actually thinking about this? Is it the case that what's in their head currently might actually be shaping prospects for new communication? And in fact, we actually have found that this is the case. So recently, my colleagues and I wrote this for an essay in the journal Health Communication, in which we found that in a nationwide survey here in the United States, that actually people's willingness to think about potential future vaccination was very much a function of their previous experience, and was very much a function of how they thought about flu vaccination. And so we actually found that this projected willingness was a function of past vaccination behavior. It's a little bit of a potential problem because flu and COVID-19 are not the same disease. And so it's interesting to think about how people are trying to grasp at and use existing ideas to apply to a new situation, but it also suggests some challenges, something that needed to be kept in mind as we're going to do public engagement work in this arena. And so you might think about how all this applies to your own work to do knowledge mobilization, your own work to do translation of your research. And here, I want to raise the notion of trust, which might seem like a bit out of the blue. But actually, I think this is really quite important as you think about the relationship that you're going to build with your audience. And so as we think about doing translational work, we have to understand how is it that people are thinking about the university that we reside in? How is it that they're thinking about our field? Are they thinking at all about the particular work that we're doing? And the notion of trust is important because I think it's a concept that people will often acknowledge as important. It's important to be trustworthy. It's important, trust is an important factor in predicting whether or not people are engaging with information or believing it. And yet, I think we often, overlook certain aspects of trust, here. And that's something that I think is important for us to unpack a bit. So we know that trust matters in all sorts of ways. Trust is certainly predictive. Trust is predictive of behavior. Trust is predictive of people's willingness to engage in information. We saw this in the US on a US Centers for Disease Control and Prevention project related to Ebola and screening related to Ebola. Travelers incoming to the US were met at the airport with ambassadors and representatives from CDC. And the extent to which people trusted those individuals was really important to know in terms of their own intention to actually adhere to the recommendations from those individuals. So trust was something that matters. It was important. However, it's also important for us to realize that trust is multidimensional in important ways. So not only might we think about trust in terms of simple credibility or believability, but we also need to think about trust in terms of consistency. But importantly, we also can think about trust in terms of shared interest. To what extent do people actually perceive that there are shared interests between researchers and the audiences that they're trying to reach, shared interest between universities and larger constituencies. This is crucial. And so to bring this back around to the notion of a mental model, to what extent, as people think about research, do they see themselves in that endeavor? Do they see their interests in that endeavor? Do they see this as part of the consideration of the work that you and your colleagues are doing? And if not, there needs to be an effort in the translational work that you're doing to actually point out and highlight those points of commonality. This is something that could be added to one's conceptualization of the work that you're doing, but it might need to be explicitly done. And so, to what extent are you highlighting the possibility for shared interest between you and the people that you're talking with? That turns out to be vital when it comes to trust. It turns out to be vital when it comes to acceptance, of work in a translational sense. So, as we think about our effort to do translation, to do knowledge mobilization, to what extent, as we're doing that, have we actually also identified and spotlighted interests between researchers and people outside of academia? To what extent can the framing of your work actually try to highlight those potential shared interests? That's something I think is worthwhile to keep in mind, and it's often not at the foreground as people think about, here's this exciting aspect of my work, I'm going to dive right into that. Well, have you first offered a sense of how this is relevant to an audience? Have you first offered a sense of actually how my doing this and your interest in this might be aligned in terms of our shared fate, our shared interest in this somehow making the world a better place? And so all of that is, I think, crucial, to keep in mind. We've kept this in mind in a number of efforts, and I just want to spotlight two of these. One was last year, an opportunity that we had to work with Excite, and that is the Professional Association of Science Museum Professionals. And in working with Excite, one of the aspects that we worked on, we were working on an effort to actually address misinformation and scientific misinformation. But along the way, what we realized, what was crucial about a science museum was the place that a science museum held in a community. The opportunity for that museum to actually be a real physical or a virtual forum or a center or a place for conversation. And that turned out to be part of the avenue that we ended up recommending, was that science museums start to better realize this opportunity they have to bring different parts of a community together, and not necessarily just be a source of information in an outward sense. Similarly, we've done a lot of work with clinicians here in the US. My colleagues and I at Duke University have developed a workshop for clinicians, again, to address misinformation. But really at the core of what we're doing is encouraging empathy and encouraging trust building, really as the pathway forward. We really encourage clinicians to listen to the values that are expressed, even when patients are espousing misinformation. What questions can be asked about potential shared interest and shared value? We think that's a better way towards having those conversations. And metaphorically, I think that's really important for anybody to keep in mind who's doing knowledge mobilization work or doing translation of science work generally. So then, in sum, one of the questions that we need to ask is about all the work that can happen prior to your issuance of a press release, prior to your posting a headline on a website. What work have you done to build a relationship with audiences? What work have you done to figure out what mental models audiences have of the kind of work that you are talking about? And in cases where you're dealing with complex science, what work might need to be done to actually give people the cognitive architecture and the tools to understand what you're talking about? To what extent do you need to actually help build a mental model before you then attempt to add to it with your latest research? What steps can you take to lay the groundwork today for the translational work that you're going to do tomorrow? I think if we do that, if we take a deep breath and reach out to audiences, try to understand where they've been, try to understand alternate information sources that they might have, that's going to make the work we're doing for knowledge mobilization and science translation that much more effective and useful.